So when we were putting the program together, we were all asked, is there one of the speakers that you would like to introduce? And I immediately raised my hand and I said, I want to introduce Sandy. So it really is my honor, my pleasure to introduce Sandy Markwood, our first speaker today. Throughout my career, I have been aware of Sandy. She doesn't know that, but we were kind of comparing notes about how long we've been in the field of aging, and it's been a while. But over the years, I've attended many national conferences, and Sandy's always there. And Sandy's always there talking about the age wave, and we got to get ready, and we need to create livable communities. She has an incredible passion for what she talks about, and you're going to feel that passion when she's up here today. Sandy currently serves as the CEO of the National Association of Area Agencies on Aging. She is a tireless advocate for and a champion for aging networks across the country. She continually creates new initiatives through the N4A that all of us as area agencies on aging have been able to tap into, like the Livable Communities Collaborative. I've actually had the pleasure of getting to know her at a more personal level when I took this job as the AAA director. And I am, again, continually amazed at her energy and passion on this topic. What she told me is that yesterday she was at a Senate hearing talking about livable communities and literally had to run down the concourse to get on her airplane to get out here today. So we're really excited that she's here. Sandy has more than 30 years in the field of aging. She graduated with distinction from the University of Virginia with a bachelor's degree in history and a master's degree in urban and environmental planning. So help me welcome Sandy Markwood to Larimer County.
In addition to the fact that you were asked to turn off your cell phones, this is just another example of all the technologies that we have to be able to do things. And in saying that, technology and aging and technology is also a key factor in creating livable communities. So in saying that, it's my pleasure to be with you this morning. I am so excited to be in a room of so many people who are so interested in aging and also aging advocates. So we're going to need your advocacy as we move forward on this issue and others. But in saying that, it's my job. I think I have the best job today because it's my job to get you jazzed up about why age-friendly communities are important and why they're important to you. So in looking at this, my organization, the National Association of Area Agencies on Aging, represents the Larimer County Office on Aging and over 618 area agencies just like this, though yours is really, really good, across the whole nation. And we have the ability to touch the lives of millions and millions of older adults and people with disabilities more and more, and caregivers across the country. But the vision of my organization has nothing to do, when you look at it, for older adults. The vision is to build a society that values and supports people as they age. And that's what a livable communities for all ages is. It's recognizing, as Linda said, that what we really want to do is to create a community that's a good place to grow up, a good place to live and raise your family, but also a lifetime community that you can live in as you grow older. So in saying that, the mission, and I am so thrilled that Mr. Johnson really highlighted this in his presentation, his opening this morning, is really to be able to do that, to ensure that older adults, people with disabilities, caregivers, really everybody in this community can live and age successfully with dignity and independence in their home, and I put and or their community for as long as possible. We used to just say and community for as long as possible, but I changed that to an and or because what I realized in talking to people across the country that sometimes you can't stay in your home. But even if you find that it is difficult or you don't want to stay in your home, You want to stay in your community because that's where your attachments are. That's where you get your strength. That's where you get your spirit. So in saying that, that's the vision and the mission of my organization, but I really want it to be the vision and mission for each one of you as well. In saying that, as we look at this community and communities across the country, I divide the world up into two groups. I do. People who determine themselves as old. Now, I'm in a group of people, traditionally, I said, well, okay, so what's old? Okay, I'm going to do it with you. So what's old? 50? 60? 70? 80? 90? 100? Okay. All right, and that's a huge change. Because it doesn't matter. I'm not going to put a marker up there and say, you're old when you're 60, 65, or 70. I turned 60 this year. I think growing older and aging is wonderful, but I don't necessarily consider myself old. That being said, being old, however you define it, is a wonderful, wonderful thing. If we turned the clock back to 1900, when the average age of an American was 46 years old, not many people here might be in this room, right? So the fact that people are getting older here in Larimer County and across the country is really something absolutely wonderful. So this is the other group of people. Those people who will hopefully be lucky enough to become old. So there's only two groups. Those people are old and those people who hope to be old someday, right? So when you divide up the community like that, aging is an issue for everybody, right? Successful aging is important to everybody. But this is another part of aging that sometimes doesn't get highlighted as much as it should. And this is a quote from former First Lady Rosalind Carter, who says there are only 4 people, the way she defines the world. There are only 4 kinds of people in the world: those who have been caregivers, raise your hand; those who are currently caregivers, keep your hands up; those who will be caregivers, and those who will need caregivers. Everybody's hand in this room should be up. It's not just an exercise this morning. You all fall into one of these groups, absolutely. So when we put together those people who are going to age, all of us, those people who are going to be caregivers, all of us, then that really means that aging and this issue is important and critical to everybody in this room, everybody in this community. And that's why you need to be excited and jazzed up about ensuring that this community can be age friendly. This community will be a livable community for all ages. So, celebrating our longevity, again, I think the fact that we're living longer is a great, great thing. The fact that you have now, from 1900 to where we are today, you have 30 more years of active living. That's great. That's great. When a person turns 50, they have half of their adult life still ahead of them. Think about that. That really makes you approach your life differently, right? And hey, people over 60, studies are out there. You're happier. You know, who would want to go back? For those in the room, I'm sorry, if there are some 20-somethings in the room, I would never go back and be 20 again. Oh my gosh, never. Thank goodness. You get angst over everything when you're 20, right? And also, conscientious people live longer. So I need everybody in this room to be conscientious about creating an age-friendly community because you're going to live longer. So in looking at that, but this is the reality. The reality is that at some point as you age, I'm not sure when it will be, you're not sure when it will be, you're going to need some help probably to be able to age successfully in the community. And the key is will that help be there? Will it be there with your family and friends and caregivers? And if so, how can the community help to support that? If you need community services, how will the community services be there to support that? And again, as was raised this morning, those community services aren't just the wonderful services provided by the Area Agency on Aging. They're also services that are inherent in what your community does for everybody, transportation being one of those that's key and critical, because you can have the best services in this community, but if people can't access them, if they can't get there, they have little value. So looking at where you're going to need services and the fact that you're going to need them over a longer period of time, because again, we just defined what's old. Everybody, the likelihood that people in this room will reach 90 and 100 is increasing every day. And so as people age and they hit this, by 2015, we've got 42% of people who will be living longer and living to the age of 90. But fourfold increase. And then what this chart shows you is what I highlighted is the fact that as people age, and especially that chart of how many people are going to hit 90, look at the statistic on how many people 85 plus are going to need some level of support to be able to age successfully in their community. Over 50%. And I think that's probably a very conservative figure. So we need to look at how we can make this community a good place to grow up and to grow old. And so I wanted to talk about one issue that's in the room, though. I'm not saying that any of us need to define ourselves as old, but we do need to define the fact that we're aging. And we have aged since the moment we were born. And, I'm glad that guy's on a bike. Good for him. But, there are certain things as we look forward to aging, I think, that aren't helpful if we deny the fact that we're getting older. Because then it's like when I talk about creating age-friendly communities, people go, oh, that's for them. That's for those people, not for me. And I think one of the things that we need to really celebrate if we're going to look at aging is the fact that, hey, this is a good thing, but I need to be able to look at this in a way that will help, that I need to plan for my own aging to make sure that it's going to be successful. All right, so this is my formula for successful aging. You don't need to write it down. But this is what I believe is true. In my 30, 40, however many years I've been working in this area, what I think is that if we're looking at really making sure that people can age successfully in every community in this country, in Larimer County, but everywhere, individuals need to plan for their own aging, which really kind of goes back to that whole Peter Pan syndrome. We need to recognize and celebrate the fact that we're going to be getting older and realize that for every other element or every other phase in our lives, we've done planning. And if you're a baby boomer, how many of you are baby boomers? Raise your hand. I am. Yeah. What do? Every time we enter a phase of life, we buy a self-help book, right? What to expect when you're expecting, what to expect when this, and then when we send our kids to college, we buy them these books. There was a book when my daughter went off to college, something about, what do you do about a naked roommate? And it really wasn't about just that. I mean, it really was walking through the whole process. But, we want to know how to do it and to do it well. Well, we want to know how to do aging well, too. So I really encourage you, think about your own aging and think about that in the process of creating an age-friendly community here in Larimer County. But also, you need to engage your families. And it's helpful if your families are here, but even if they're not, they need to be engaged because we know that caregivers, remember the Rosalind Carter quote, are the backbone of the long-term care system in this country. Somehow they will be engaged in helping you age successfully, so they need to be part of your plan and part of your process. But also it's this last point, which I think is gaining momentum here in Larimer County, but you're part of a movement that's happening across the country. And that is that communities need to plan and support people across their lifespan. As Linda said, I'm an urban planner by trade. I'm not a gerontologist. But what became very clear to me as I was working in my field is that people were planning communities that had nothing to do with the people who were living there or hoped to live there over the course of their life. In the 1980s, I did a study with the U.S. Conference of Mayors on the graying of suburbia. We surveyed different planning departments all across the country. What we found is that my colleagues weren't even looking at the demographics of aging. They really weren't even looking at the demographics, period, quite honestly. So we need to change that. We need to make sure that communities are engaged in looking at the people who are in the community who want to stay in that community. So in looking at that, we need to think about aging here in Larimer County, and you've already started that process in engaging everyone and major stakeholders in looking at this issue. But you all need to be involved in this too, because it's not just, again, when we're talking about creating a livable community for all ages, it's not those people, it's us, it's you. And so you need to have your voices heard on what you want here in this county as you grow older, or your friends grow older, or your neighbors grow older, or your parents grow older. So communities across the country, and we've been so pleased to be engaged, like Andy Sharlock, who is going to be talking to you this afternoon about helping communities really think intentionally about what they want their communities to be as they grow older. And it's exciting because you look at this and you can't see it really well, but it says lifelong learning, healthy living, safe, walkable, accessible neighborhoods, transportation, local, recognizing that as you grow older, you're still productive and part of the local economy. You know, it's looking not only at the needs of aging, but also the assets of aging and being able to capitalize on that. So I wanted just to highlight a couple of areas that I think are key and critical as we move forward, things that I want you to think about as you sit here today in this room and hear from lots of other folks about issues related to aging in your community. But as importantly, when you go home, I want you to think about these issues. I want you to, when you drive down your street in your neighborhood, I want you to think about these issues. When you go into your house, I want you to think about these issues, about how this will impact me 10 years from now, 20 years from now, 50 years from now. And for some, I'm looking at the youngins in this room, even longer. So in transportation, so if I passed around a basket, which I've done in meetings before, and said, okay, could you please put your car keys in them? No, I'm really serious. Put your car keys in the basket. And then tell me how you're going to get home. You know, transportation. So recognizing that as we age, and again, there's no magic point, there will be a point where you may feel uncomfortable driving at night. You may feel uncomfortable driving on freeways. You may not be able to do that. And in saying that, how will you get around your community? How will you access the places in your community, whether it be healthcare, whether it be your pharmacy, your grocery store, your church, your synagogue, or the mall? How are you going to get there? That's key and important. So transportation, I think, is something you really need to think about. At N4A, we run the Elder Care Locator. It's a 1-800 number for the Administration for Aging and the Administration for Community Living. Basically, we get calls from older adults and caregivers across the country who don't know who to call locally to find out about how to access services. The number one issue people call is trying to find transportation in their community. Number one issue. So think about it. How are you going to get around? Housing. Housing is a huge and growing issue. Accessible housing, affordable housing, you know, housing that meets the needs of people. And this kind of goes back to where I said, we used to say keeping people in their homes in communities for as long as possible. I don't know about you, but you know, I didn't buy my house and thinking about what I would need when I was 80 or 90. I didn't think about it. I was trying to fit all the kids in there and trying to find the schools and those types of things. So I personally am not going to age in place in the house that I live in now. I'm already starting to look at different housing options in my community. But if you want to age in place in your house, how will you need to adapt your house to be able to age successfully there? Think about that and start planning for it. Or if you think that you want to stay, you may not need to stay, or you may not want to stay in your house, what kind of other housing options and alternatives are available here in Larimer County? And if the options aren't here that you want, Now's the time to start talking to folks that are doing that plan to make sure that they develop the zoning and subdivision ordinances and all those land use practices that are going to impact what types of things are built here or what types of things are rehabbed here in the future. So housing is key and critical. It's where we live. Whether you will age in place or whether you will make a move. In saying that, one of the other key issues is access to services and supports at the community level. You all this is my first time here. What a beautiful, beautiful area you live in. And I'm seeing that you really do have really good planning here, but I have been multiple places in the country where, and this is largely a result of my own urban planning profession, that through zoning have put houses here and the mall was here and all of the industrial things were here and where you worked was here. They divided up communities thinking that that was the best way to do it from a public health perspective. And what it did is created urban sprawl and nightmares because people couldn't access the services that they needed unless they had, usually if they got in a car. So the question is, you all have unfortunately had a lot of disasters and are looking at redeveloping your community in lots of different ways. And your community is so beautiful that you will always have a lot of development here because people are going to want to come here. But making sure that you look at what do people need? What do you want when you live somewhere? Do you want to be able to bike or walk to a grocery store? Are there grocery stores in your neighborhood area, or do you have to drive far away? How many times do you have to get in your car to get to the places that you really want to get to? Do the public transportation routes connect to the places that you want to get to? Making sure that as we look at access is how can I get to the places that I want to go? And making sure that you're part of the conversation with that, because that is urban planning. That is community planning. That's community engagement. And this is what you need to be a part of. You need to be involved in. So the other part of it is economic engagement. Now, I would say, again, I admit it, I'm a baby boomer. And when I think about my own aging, I have to admit, I'm not looking at retiring anytime soon. I still have kids in college. So that being the case, I need to stay in the workforce. I want to stay in the workforce. Plus that, I have the best job in the entire world. And so, I'm real excited. But, other people have different aspirations, and that's great. But recognizing that you are an economic engine, just because of the sheer numbers of older adults that you're going to have in your community, and also recognizing, yes, it's older adults and the caregivers, think about the power there, is making sure that there are economic options and opportunities available to you to stay in the workforce and or to volunteer. But also, and I know that you're already starting this, is to work with the local businesses in your community to make sure that they recognize and want to be age sensitive. And what do I mean by that? How many times have you walked into a store and the aisles are so crowded that you can't get through? You can't get through when you're walking. A mom can't get through if she's trying to, pull a stroller and toddlers. And anybody who is using a wheelchair or walker could never get through. I don't think a business really intentionally sets up the aisles that way. I just don't think they're thinking about it. And actually having, cashiers who are sensitive to the fact that there may be some people who go through their line that may need a little bit more help and take a little bit longer. So, making sure that everybody in your community recognizes the economic value of ensuring that people can age in place here in this community and be involved either from a workforce perspective and also recognizing that you will create workforce opportunities in this community as people age, but also recognizing that business needs to honor and respect and celebrate the fact that there are older adults in the community. The other thing is health and human services, recognizing that this whole sphere is changing as people age. On the health side, there are more and more opportunities for older adults to get engaged in preventing acute illnesses. And also there is more recognition of the importance of connecting the acute care world, and I'm glad that there are sponsors here from the healthcare industry, connecting the acute care world with what happens in the home. Where does health happen? It happens in the home. It happens in the community. I mean, you go to a hospital if you have an acute situation. You go to a doctor to maintain your health, and if you're not feeling well. But most health happens in the home. And one of the key factors for area agencies on aging is to be able to be that bridge between what happens in the acute care world and what happens in the home. But then also on the human services side, the social services side is recognizing that more and more those are blending with healthcare, and we are looking at more and more ways to roll out evidence-based programs. Evidence-based programs meaning proven programs to be able to help people age successfully. Let me just throw out a couple of them. Matter of Balance Falls Prevention, a program that costs less than $100 per participant. The average cost of a hip replacement, what do you think that is? Right. $5,000. Chronic disease self-management, $8,000, much more. Those people who are healthcare folks in the room know better than me. $70,000, I am not getting a hip replacement. So, you know, in looking at that, so these are chronic disease self-management, helping people recognizing that that's another reality as you age, you get chronic diseases, but you can manage them. There's programs out there to help you. And active living programs, which you all are really active here because you live in a beautiful place, but nutrition programs, also brain health programs. So there's lots of opportunities here for you to grow prevention in your community to help people age successfully. And the other thing I have to say, because this is a major issue and it's a major push for the administrator of the Administration for Community Living, is the growing abuse of older adults. And oftentimes when you say that in the room, nobody go, oh, not here. Well, it happens everywhere, and it's often very, very hidden. What's become more public are the scams against older adults, and those are growing to the extent that the Department of Justice is trying to get involved in this because it's a real huge issue, but it's also a community issue as well. And it's not just scams, it's abuse and neglect as well. But also looking at social engagement. Again, if I look out on your older adults in this community, and I'm not looking at any of you in particular, because you want to be engaged in your community. Everybody wants to be engaged. You want to have fun, right? So in saying that, how to make sure that you have those opportunities to be engaged as a volunteer, just to have fun in their community, but also to do what you're doing today, is to be civically engaged in your community, to be on commissions and committees that really are making your community a good place to grow up and to grow old. So the other surprise that I have here, because I know that there's been a lot of talk about, generational issues. Well, if we do this for older adults, well, what are we doing for other folks? Well, I'm here to tell you that there is not so much of a difference at all between what millennials want and what older adults want when it comes to community planning. Because what millennials want are, if you look at people getting married today, you remember, I don't know, when you got married, you did the registry and you got the china and the crystal and all of that stuff. Do you ever use it, really? Do you ever know? No, you don't even. Well, the millennials, they're smarter than us. They don't even register for that stuff. They don't want all that stuff. They don't want the stuff. They'd rather do things. So what do people do when they get older, especially if they, and I'm saying quote unquote, retire? They want to do things. Yeah, you may want to have a yard and you may want a garden, but you don't want 5 acres. Yeah, you may want a house, but God, do you really want to take care of a big, huge house? No. Millennials don't either. They want to do things. So what we're seeing more and more across the country is the types of communities that millennials want to live in are the same types of communities that older adults are looking at. And I can use my own area as an example. There's an area that was a blue-collar railroad part of Alexandria, Virginia, where I live. And now the millennials and older adults who are moving from their home where they raise their kid are fighting over these houses because they all want to live there, because it's this cool area where you can walk to a coffee shop, you can walk to the library, you can walk to the metro station, and they're really neat bungalow, Sears bungalow catalog houses. Everybody wants to live there. So when we're looking at creating an age-friendly community, again, I put it in the context of these are really communities, lifelong communities where everybody wants to age. So, community matters, right? Where you live matters. And I want to show you a couple of ways why it really matters. It matters to your health. When you look at the impact of where you live, environment is more of a predictor of your longevity than medical care. I'm sorry for the medical care people in the room. But it's really close to genetics. So where you live matters to your health. So you got to get involved and help make decisions about it. You also need to look at your own personal habits too, because that's the biggest one. Where you live matters as far as transportation. It matters whether you are aging in place and stuck without options, because as I said, there's great things in your community, but if you can't drive or you don't know how, can't get, or your bus routes don't go to them, you're stuck. You're stuck. And there are a lot of communities in this country where people are stuck in place, and I don't want this to be one of them. Community matters whether you're going to be isolated. And this is a sad thing, and sometimes it's hidden in neighborhoods. It matters if people can't get out. It matters if they're not socially engaged. It matters if their house is a house that doesn't suit them. They don't have transportation. Nobody comes to visit them. There's not social engagement. It matters. It matters. And again, this is not what you want for your community or for yourselves. It matters whether you can get access to health care. It matters if you can get access to the support systems in this community. How you plan this community, whether it will be age-friendly, a livable, lifelong community, matters, and it needs to matter to each of you. So, where you live matters, and you will determine through your actions how this community will respond to people across the lifespan. So in saying that, I just also wanted to show and highlight a couple of things about what happens if people don't get engaged and don't think it matters. So this is a community that people have to walk in the street because the sidewalks are deteriorating. Happens in communities, and in saying that, recognizing that keeping up with infrastructure at the community, again, I worked for local government for a long time, is a difficult thing. But being able to walk and being able to engage in your community is key and critical, and being able to be out in your community is key and critical. Are your communities safe and walkable? Let me see. And I joked around about passing around the basket with your keys, but this is a reality. When it's time to hand over the keys, who's going to make that ride happen? Because what we know, and men, you do it longer than women, is you really drive longer than you should by 7 years. And I've been in the car with many of you. And I'm telling you, I was scared. But part of that is, so what's the option? How am I going to get places? And that's a real reality. It's not only having the options, but training people, if they have options to utilize public transportation, how to do it. If you've never done it, it's kind of scary, right? How do you get on the bus? But oftentimes in looking at the buses, yeah, there may be a bus stop, but there's no bench. There may be a bus stop, there's no, and here you get so much sunshine, it's not as much of an issue as it is other places. There's no shelter. So, looking at how do you make sure that transportation is a real option? Because I'm telling you, especially with the rise in dementia, I've had that happen in my own family. It's a very scary thing to find people who are wandering around and don't know where they are. And we need to really recognize that and engage families, individuals, and the community to be able to help get people where they need to go. Housing, and I'm not saying, I would believe that, you have this is a great community. But you know, the one thing that we do know is sometimes older adults who are living on limited incomes really cannot keep up with the home repairs that they have and they need. And you know, sometimes we've walked into, people who have delivered Meals on Wheels have walked into houses that have been very scary. And again, houses where the people should not have need to move to someplace else. People who are Meals on Wheels delivery folks, and there may be many of you in this room who walk into a house and deliver a meal to someone who is very appreciative, but you notice the fact that they're going up and down their stairs on their tush because they can't walk up them. You know, we need to look at that, and we need to respond as a community to rehabilitation needs at the community level, and making sure that, again, the community, that housing is accessible to people given their mobility limitations over time, if that would happen. But the other thing is, you all need to get engaged in preventing crimes against older adults in this community, and scams against older adults in this community. And there are more and more initiatives, and Inforay is now working with, about to work with Wells Fargo to look at ways to educate people who work in the banking industry with community leaders, so that if you walk into, if you see somebody who is walking into a bank with an older adult and they're kind of hanging out in the parking lot, and the older adult, I'm just seeing some shaking heads and people walking in with checks, you know, that's likely a scam. And that's not something that any of us should turn our heads and walk away saying it's not my issue. It's our issue, and we need to deal with it. Crimes against the elderly, again, are on the rise in every community in this country. And the other thing is, you know, again, I admit I'm an urban planner, is making sure that as your community grows that you can get around your community, because really, who wants to live here? You know, who wants to live here? And again, being able to tackle isolation, and part of that is being a good neighbor. Part of that is recognizing that if you pull into your driveway, that you are, I believe, responsible for everybody who lives around you. I do. I believe that. I believe that if you see newspapers piling up in your neighbor's yard, you need to go ask them what's going on. If they're out of town, then you should pick up the newspapers. But if not, there may be an issue that you need to know. My next door neighbor for many years was a 90-year-old woman. I had the privilege of knowing her for 7 years before she passed away, who was actually the realtor for the whole entire neighborhood. Her name was Dee Webster, and she was a gung-ho woman. She would sit out on her porch and we would talk, and I would find, and if I went to the grocery store, I brought Dee whatever she needed. If it snowed, we were out there, we shoveled her walk first and then our walk. That's being a neighbor. And those are those types of volunteer actions happening all over the country. We weren't special. That's just what you do to help people out. But it helped me to know too, and this is key and important, she had an alarm on her house, and she had dementia, and she accidentally set it off, and this was in the middle of the night. We had the access code to her house. The fire department was coming. She couldn't hear. They were about to tear down her door with an axe, and we had to go over and immediately stop that. How many of you know the people who live next door to you and are there to know what their codes are, if they have that, or what their needs are? You need to. So, you know, again, being a good neighbor. So, on the healthcare front, so what fits your busy schedule better, exercising 1 hour a day or being dead 24 hours a day? Okay? All right, enough said there. You need to have an active, healthy community, and you need to get people engaged. Okay, so everybody at lunch, go for a walk. So what choices will you and this community make, and what options will you put in place to make sure that Larimer County is the best community in Colorado to age in place? And I know we have people from other areas of Colorado in here. But really, you guys are on the way to do great things. And it's everybody in this room that's going to make that happen. And you are already part of a movement. If you didn't know that, I'm here to tell you. And in fact, on the table over here, let me grab this, is a copy of the executive summary of the report that Linda said we just, N4A just released yesterday up on Capitol Hill. It's called Making Your Community Livable for All Ages, What's Working? And I know that we're going to hear more about what's working across the country today. But we released this. You all were part of a learning collaborative that N4A did with 5 other communities across the nation. It was you, let me see if I can do this by heart, Miami Gardens, Florida, Sedgwick County, Kansas, Santa Fe, New Mexico, Monroe County, New York, and York, Pennsylvania. Thank you. Where we went in and helped facilitate already some of the stakeholders in this community, and you all are already moving forward. And so you're part of our network, and you're also part of a movement in this nation to be able to create livable communities for all ages. The AARP, and they're one of the sponsors of this, just released a Livable Community Index just a couple weeks ago. What you're doing here, what you're discussing, is getting buzz all over the country. I want you to be the leaders that everybody turns to when they talk about livable communities for all ages. You're already well on your way. In saying that, what will your community be? How do you want to define it? What's your aspiration for an age-friendly community? I'm just going to throw out a couple of options. Larimer County, embracing aging. Exclamation, exclamation. This comes from York, one of the other livable communities that started this whole movement to, in their community, dispel ageism. You know, in addition to starting other they found that there was ageism in their community. People really weren't embracing aging. So now they have this whole public information campaign, and they have pictures of an older woman, and they have them side by side. And on one, it's in the bigger copy of the book, you know, and they have a vision saying, well, what do you see? This vulnerable older woman, da da da. And then what do I see? I see an advocate. I see somebody who has a lot to contribute to this community and is. So again, looking at embracing aging. Larimer County, age in everything. Age in everything. If everything we're doing is looking and moving towards a lifespan community, we need to look at age in everything, transportation, housing, everything. Looking at policies and programs saying, how will it impact people across their lifespan? Being intentional about that. Larimer County, a great place to grow up and a great place to grow old. Isn't that what you want? You don't want people to have to move. You want a lifespan community, a lifelong community. Larimer County, a lifelong community. Larimer County, your home for a lifetime. Because isn't that what you want, right? You define it. But I just want to go quickly over what we have determined to be kind of the top 10 things to look at when you're developing an age-friendly community. Collaboration across traditional sectors, health, human services, but go beyond that, because the business community and others really need to be engaged in this as well. Celebrating the diversity of your community, racial, ethnic, and the like. Building relationships. Relationships in this room, relationships in your neighborhoods and your community. Making this a relationship strengthened community and honoring the uniqueness of the community that you have here in Larimer County. Not trying to replicate what somebody else did or taking it cookie cutter, but looking at what will work here in your community and celebrating and revering aging instead of hiding it and not owning up to it from the Peter Pan principle. Embracing longevity as an opportunity, tackling the social factors that determine wellness, kind of going back to those circles. Seizing opportunities to infuse aging in everything in this community, sending the right messages to the right people, recognizing that what we're not talking about here is focusing on older adults in lieu of anybody else in the community. It's older adults as well as everybody in the community. And the fact that you can, and by doing this, is leverage local resources that already exist in your community to get this work done. It doesn't mean you need to get a new grant with a huge infusion of new funds, though that would always be nice. But it's also recognizing with the transportation and housing and different funds that you have in place now, both on the public and the private and nonprofit sector, they're great things that you can already do. So in moving forward, let me see here. I'm going to ask you, this is what I think you should do. Get engaged in this effort. You're here. You're advocates. You want to age successfully. I know you do, but you also want everybody else to age successfully here too. Get engaged in creating this work. The folks in Larimer County that have already started this effort need your help. They need you, and you need to have your voices heard. Make sure you're planning for your own aging. Think about it, talk about it with your family, and plan for aging like you plan for everything else. And lastly, I'm going to challenge you. I want you, each of you, to strive every day to do one thing that makes this community a better place to grow up and to grow old. One thing. It could be taking in a neighbor's trash can. It could be checking on a neighbor who you know may be ill. Do something small, because those small acts of kindness add up. So I know this is an overused quote, but it's one that really resonates with me. Never believe that a few caring people can't change the world, for indeed that's all who ever have, the Margaret Mead quote. Sometimes we hear that so often we go, oh, yeah, yeah, right. Me, I'm going to change the world. Well, you are. And you already are by the actions that you do every day. It's how intentionally you change the world for the better. But this is my favorite quote. Unless someone like you cares a whole awful lot, nothing is going to get better. It's not. It's time to start planning for age-friendly communities, livable communities here in Fort Collins and Larimer County, and you are the right people to do it, and this is the right time to do it. Thank you very much.
So the first question here is, what are some tips that you have for engaging the business community?
Oftentimes, I think the strength in looking at the business community, and again, I don't think it's the fact that the business community isn't interested. I think you need to use the right hooks to get them interested and to realize that it's in their best interest to do this on the one hand, and also recognizing they have a philanthropic interest on the other. What I need everybody in this room to do is to know the demographics of this community. How many people who are over the age of, you pick the marker, 60, 65, 70, 75. And then also, again, how many people are caregivers? Typically, it's 1 in 4 adults is caring for is a caregiver in some way or another. If you walk into a business with those two statistics, and that is some pretty powerful stuff about talking about a market, right? If you're talking about how many people they serve, one, that will capture their attention. 2, the fact that people are aging in place. So this is not an episodic market point in time. This is a market over the long haul. So recognizing that they need to move in this direction. And really, a lot of folks, the big companies, are already recognizing that, though their age sensitivity, isn't quite there yet. I think go in with the definition of what the market here is for older adults and caregivers, key, and also offer opportunities through the aging advocates that are here about ways to make their businesses more aging sensitive. Offer them to serve as a focus group for them, or do assessments on a positive side, not on a negative side.
A little bit of a similar question. How do we get the attention of planners?
Well, since I'm one, I have to say that the American Planning Association has picked up on aging. Yay, after many years of pushing. And they have recently had a paper out on engaging in planning for an aging population. I wasn't there, but I heard from my colleagues that at their last annual conference, which was just a few weeks ago in Seattle, it used to be that we would push to get 1 or 2 aging sessions on there. They had an entire track, and the rooms were overflowing. There were people in the hallway. The planners are getting it, but oftentimes they get it in a very stereotypical way. of, oh, we need to care for those older people. Not recognizing that there are multiple generations that fall into any age category, and also the fact that they don't necessarily look at the assets of aging. So again, hit it on the market, and I think you've got much more fertile ground there than you ever had before.
So another question for you. You did a presentation to Congress yesterday. What were your main points and how did they react? Do they know that they are aging as well?
That is such a good point, because I tell you, you go into those rooms and you go, wow, I can't believe you don't get this. Really. I think they are getting, I think that the members of Congress, and I have to say, we've always looked at aging as a nonpartisan, bipartisan issue, because, people on either side of the aisle are aging, and though they don't admit it. But in saying that, what we're understanding from policymakers is they, like so many people, are entering this from the caregiving side. They're caregivers. And there was a hearing on the Older Americans Act last fall on the House side, and very conservative people who are on the dais, and every single one of them had a caregiver story. Every single one of them had one. So I think from the policy perspective, they're starting to get at the issue that we have there, at least in DC, is the budget issue. So what we're trying to make the case, and need you as advocates to do it as well, is focusing on the fact that keeping people at home and in their community is at least 1/3 less expensive than keeping them or having them go into an institutional setting. I support nursing homes when people need that level of care, absolutely. And the last few months of my mother's life, that's where she was, that's where she needed to be because of her medical condition. But recognizing that that's not where people choose to be, that's not where a lot of people can be served in a community instead of an institutional setting. So we need to really hit it on the cost effectiveness of keeping people at home and in the community.
So this question is wanting a little bit more information to support the two statements that you made. One, the growing abuse of older adults, and two, the crimes against the elderly are on the rise in every community in the country.
Well, and I'm not saying here, I'm just saying nationally, what we're seeing is rise in, especially because people are reporting this more than they are the direct abuse. The actual reports of abuse are so much lower than what we know to be the incidence of abuse. But the rise in scams have been phenomenal as telephone scams, mail scams, people coming to the door. And I don't know how many of you have had a call or an email from your bank saying that there's a problem and you need to fix the problem. They get your email. We've had texts. My son responded to a text, giving all of this information. It was like, close your account, because these people are very sophisticated. So scams, financial scams, are absolutely something that everybody in this room needs to be aware of, and the community needs to be intervening, both with your financial institutions and also your police as well. On the abuse and neglect front, I would refer to the Area Agency on Aging, Linda and Katie, about your interactions with Adult Protective Services. But what we're seeing is more people who are neglecting themselves because they don't want to ask for support, as well as there's still, and this is the unfortunate statistic, which still surprises me every time I hear it. The perpetrator of physical abuse against older adults are typically family members. So part of that is overwrought caregivers, but part of it is because just insidious acts of family members. We need to recognize that and look at making sure that we have the systems in place to try to cut that off at the pass, or to be able to intervene and get people to safer places. In Phoenix, Arizona, they created a late life domestic violence shelter for older women because, it happens in late life as well as happens throughout life. So there's just a lot of things I think need to be part of our our recognition on abuse.
And I'll briefly mention that the Fort Collins Human Relations Commission, along with the Center for Public Deliberation that I run, had an elder abuse summit. I'm thinking it was fall of 2 years ago or so, fall of 13, I believe. We did that on Channel 14, so that video might still be up. We have a lot of information, but we do have a group that's really been looking at it here locally. Next question. So affordable housing is a significant issue in Larimer County. We'll be here a lot more about that later today. Do you know of any communities that are doing it particularly well, and model communities to follow?
You know, I think that when they did the regional forums on the White House Conference of Aging that have been going on across the country, I think everybody was surprised at how much housing came to the top as an issue. In looking at that, you know, you have a beautiful community. There are lots of beautiful communities across the country where if somebody wants to even move from the house they're living in to a smaller house, there's no cost savings. In fact, it may cost them more to move to right? I know that's the case in Washington, D.C. area. So, I think in looking at the types of housing that are being built, recognizing that, and to ensure that with developers and planners do this, is that there are affordable units built as well as other market rate, and recognizing that these new micro apartments that are being built from new urbanism do not meet the needs of older adults. So I think that we need to be intentional and loud advocates here on what's being built in the community. The other part of it is to look at co-housing. You know, we really are going to have to embrace that and recognize that, it could be fun in your latter years to live with other people. Not that way, come on. But I think that we need to look at that. And I think that we also need to be creative about, about different types of housing options. I have more questions than I have answers, but I also think what's exciting is the more we ask the questions, the more that we'll come up with out-of-the-box answers and solutions. But I think it's a growing area, and maybe, Andy, you'll go into it more.
Back to elder abuse for a second. I was just handed a card. So World Elder Abuse Awareness Day is June 12th, and we're going to have an event here in Larimer County out at the ranch. I think this is the Office on Aging. 9 to 12. I was trying to find the time. So it's in the morning. So we have cards out there on the table for the Larimer County Office on Aging if you're interested in that, if you want a little bit more information about the elder abuse issue. Okay, Bill Thomas, originator of Eden Alternatives, believes that ageism is a major social cultural factor today. Do you agree?
Unfortunately, I do, and I think it's hidden. I think that, I have been guilty of this as much as anybody. But how many of you have sent those cards? Those birthday cards about aging, and somebody pointed out to me, well, that's ageism. You're promoting ageism if you send those cards. And how many people, when you talk about yourself, don't tell people your age because you're fearful of what they'll think about it. I think that we need, daggone, look at the force of the numbers of people who are getting older. I think we just need to be louder, and I think that we need to push this issue to the forefront. And age discrimination is out there. And again, that came up through the White House Conference on Aging. I think we need to have a campaign that focuses like the folks in York County that says, when you look at me, don't look at my needs. Look at what I can give. Look at what I want to give. Look at the assets of everything that I have. And that's really a public campaign. But that campaign begins with each of you, because it also depends on how you own and accept your own aging and how you talk about it and deal with it within your family and within your community, and then let's blow it up and get rid of it.
So kind of a follow-up on that, have you found any co-housing communities to be affordable? How does the co-housing work?
Well, it works different ways, because there's co-housing, and Andy, maybe you can, because I know this is your specialty, is looking at different, there's folks that do intentional housing, where there's communities where people, and actually some of them you have to apply to move into them, where it's kind of intentional community. Then there's co-housing where people, there's formal co-housing where you get matched. And then there's informal co-housing in, you know, I've got this 3-bedroom house, 4-bedroom house, and I just put out an ad and I want somebody to come in and live with me. And maybe I'm looking for somebody who is my age, and maybe I am looking for somebody younger who, as part of their rent, is actually doing my yard work and helping me do different things. So co-housing, I think, can take on formal or informal definitions. I think it's happening different places. I'm not sure how all of the different studies, but I'm sure that we can get back to you on that.
What are your thoughts on employment for older adults as we live longer?
Well, I'm going to be working, and I'm hoping I have the opportunity to continue to work because I want to. And as I said, I still have kids in college, so I have to. You know, in saying that, the one thing that we know is that staying engaged, working in whatever capacity, is good for your health and good for your social engagement. But it could be paid work or unpaid work. I think the thing is recognizing the value of people over time. And recognizing that there is, again, in some ways it's tied to ageism. You know, it is, you know, harder to get a job when you turn 60. You know, it is. I've seen my friends who have been lost their positions, and it's taken them a lot longer than younger folks to be able to get back into the workforce. But part of that is ageism, and part of that is recognizing, too, that over time, giving people different types of employment options. You know, maybe when I turn 70, I may not want to work full time, but I still want to work. Are those kinds of options going to be out there and available for me? And will people recognize that as something that can still be very productive and a contribution in the workplace? So part of it is perception of value, and part of it is having options for people other than just full-time work.
Why doesn't new urbanism work for aging?
Well, I'm not saying it doesn't work, because I think there are places that are merging the concepts with aging really well. One is Atlanta. Through the Atlanta Regional Commission, they've been very intentional, and as they've done their redesigns, they've done charrettes where they've brought in the entire community and stakeholders into both large areas, discussions about how a portion of Atlanta or the counties surrounding that are going to be redeveloped, and they've been intentional about the impact on aging. And they've also done it on a neighborhood basis, where they've taken an abandoned park in a bad part of the community, and then for a weekend brought in activities that engage the entire community, but they've done it intentionally in bringing in and mingling older adults with those activities. So it's intergenerational. So I think that it can and it should be part of new urbanism, but I think it needs to be intentional. And part of that is we need to keep raising our hand and saying, what about aging? What about aging? Because so oftentimes that's not the focus. Well, I want to thank you. I'm so thrilled to be with you today. I hope that I jazzed you up about the possibilities of aging in place here and creating age-friendly community here in Larimer County. What a wonderful group of people. Thank you for having me.